Good morning, doctors and friends. So, we're from Student Group Discussion B5. We're going to present our student project called Albinisms. But before that, let me introduce myself and our group members. So, my name is Doi Bintang Masari, with student number of 2002511211. So, here are the rest of the group members. So, for the introduction, albinism is a heritable disease where the melanin levels in ectoderm derived tissues are decreased or absent, most notably in the skin, hair, and eyes. All racial and ethnic groups in the world can be affected by the skin disorder. 1 in 18,000 to 20,000 Americans is estimated to have albinism. There are 20 genes discovered as the cause of albinism various clinical manifestations. So as seen on the screen, these are the genes that affecting the albinism various clinical manifestations. This abnormality is most recognizable by the presence of white hair and extremely light skin tone. Irises are relatively translucent due to the lack of the pigment. So, because of this, in some circumstances, very light eyes may appear red. Albinism frequently causes blurred visions, including strabismus, photophobia, involuntary nystagmus, poor depth perception, and refractive errors. People with albinisms are more vulnerable to the risk of actinic damage and skin cancer such as basal cell carcinoma, squamous cell carcinoma, and it is all because of the poor melanin. Albinisms affect many organ systems. This disorder is best managed by an interprofessional team and should be addressed early to maximize the outcomes and limit the social educational impact. So here are our problem formulation for the writing of this student project, and these are the writing proposed. And here are the benefits of our writings. So that's all from me. Will be continued by my friends. Thank you.
Hello, my name is Putri Odina Arsatistiawan with last student ID number 097. And now I will explain about the section 2.1 about skin pigmentation disorder. As we know that skin pigmentation is one of the most variable and noticeable phenotypes in humans, with the natural selection that plays a role in giving variation of skin pigmentation in and between the population. So human skin color is determined by pigment that located in epidermis and dermis that produced by epidermal melanocytes produce the most critical pigment in human skins called melanin. So there are two main types of melanin. First is eumelanins and second is pyomelanins. Melanocytes that produce the melanin are located in the basal layers of the epidermis that have a main function to melanin synthesis or melanogenesis. There are very influence of melanin synthesis, such as genetics, but there are also other factors that can stimulate to inhibit the skin pigmentation. For the pigmentary skin disorder, it includes those who has a lightening in their skin color, a darkening in their skin color, the developmental of an unusual skin color, and or a mixed pattern of lightening skin color. So pigmentary disorder is mostly due to the quantitative or qualitative defects in the synthesis, degradation, transfer, and deposition of the melanin. The next part will continue by my friend. Thank you.
Okay, my name is Vivi Esquela with 3-digit number 169, and I'm going to continue about the explanation of skin pigmentation disorder. The pigmentary disorders are classified as hypopigmented or depigmented, hyperpigmented, and mixed pigmentation, or when a person has hypopigmentation and also hyperpigmentation. Hypopigmentation refers to any form of reduced pigmentation. In this case, hypomelanosis refers specifically to a decrease in melanin content. There's also depigmentation that describes a total loss of pigmentation resulting in whitish appearance of the lesional skin, for example, vitiligo and also albinism. Then there is hyperpigmentation that refers to any form of increased pigmentation, with hypermelanosis or melanoderma as a specific case related to increasing in melanin content. Pigmentary disorders onset are vary, including in early childhood or in later childhood through adulthood. Early childhood includes disorders that are either present at birth or develop in the first 1 to 2 years of life, with genetics as a vast majority of etiology. The pigmentary disorders also can manifest as circumscribed lesions or generalized and diffuse pigmentation. That's all from me. Thank you.
My name is Jason Emery. My last 3 digits of student ID is 081, and today I'm going to present about the definition of albinism. So, albinism is an autosomal recessive illness, most commonly in hair, skin, and eyes, and the most typical type is oculocutaneous, the type that affects the skin and eyes the most. There are in total 7 types of oculocutaneous albinism. There's also a syndromic albinism disease, for example, Hermansky-Pudok syndrome and Celiac-Higashi syndrome. That's all for me. Thank you.
Hello, my name is Amanda Raisa Suryananda with the student number of 2002511237. So, for the epidemiology of albinism, we can found albinism in the world is estimated to be at 1 to 70,000 individuals to 20,000 individuals, and approximately in 70%, they carry on OSHA-mutated allele, in which we made a table to differentiate between the prevalence in the types of albinism, and also the race that commonly found based on the types of the albinism and the prevalence. So the next presentation will be continued by my friend.
Hello, my name is Mandi Kirasandari Putri with my student ID number is 200251168, and I'm going to explain about the etiology. So, any form of albinism is caused by heritable mutations that can lead into defect in melanocytes, and productions or distributions. Every type of albinism also has its own specific genetic aberrations. For example, oculocutaneous albinism. OCA1 is caused by mutations on tyrosinase gene on chromosome 11. OCA2 is caused by mutation on gene that could be protein. Meanwhile, OCA3 is caused by mutations on human gene that code for tyrosinase related protein 1. OCA5 is not yet identified, and we also have OCA4, 6, and 7 that caused by any other specific gene mutations. Other type of albinism is ocular albinisms that happen due to the mutation on GPR143 gene. We also have conditions associated with albinisms, for example, Hermansky-Pudok syndrome, which is an autosomal recessive that can cause by mutation on HPS-associated gene. And we also have Celiac-Higashi syndrome. There is also a condition with albinism that is caused by mutation on lysosomal trafficking regulator protein. That's all from me. Thank you. Next.
Okay, thank you for your time. Hello, my name is Naomi Margaret Bayar Panjaitan, and my last 3 digit of student number is 167. Here, I'm going to explain about the pathogenesis of albinism. Albinism in any form is the result of an inherited mutation that damages melanocytes and makes it unable to synthesize melanin properly or distribute it through skin tissue. Melanocytes contain specialized melanin-producing organelles, or we can also call it melanosomes, that develop in the 7th week of embryonic life. There are 2 most common forms of melanin, which are eumelanin and pheomelanin. The synthesis of eumelanin over pheomelanin is stimulated by activation of the melanocortin 1 receptor or melanocytes. The first step in eumelanin synthesis involves the oxidation of L-tyrosine to DOPA by tyrosinase. Mutation in the tyrosinase gene result in the loss of ability to produce eumelanin. Mutation in the tyrosinase enzyme cause albinism because tyrosinase plays an important role in converting tyrosine to DOPA and then to dopaquinone. Hereinafter, dopaquinone is converted to eumelanin or pheomelanin. Tyrosine's mutations are seen in the oculocutaneous albinism 1 and autosomal recessive ocular albinism. Melanin deficiency increases the chance of sun damage-related disease, including arsenic keratosis and UV-related malignancy. That's all for me. The next slide will be presented by my friends. Thank you.
Hello, my name is Mira Amba Grace Fricha with student number 2002511018, and I will continue by talking about the types of albinism. So in general, albinism is categorized into 4 different types. The first one is OCA, which is the most common type of albinism. And this albinism is characterized by extremely pale hair, skin, and eyes. And there are 7 different subtypes of OCA caused by mutations in one of the 7 genes, OCA1 to OCA7. The second one is OA, or ocular albinism, which is much less common than OCA. This is a result of the gene mutation on the X chromosome exclusively in males. OA affects only the eyes and is presented with normal skin and hair color. The third one is Hermansky-Pudlak syndrome, or HPS, which includes a form of OCA along with blood disorders, bruising, issues, and lung, kidney, or bowel diseases. And the last one is Shidiak-Higashi syndrome, which includes a form of OCA along with immune and neurological issues. Well, those are the 4 types of albinism. That is all from me. Thank you very much for your attention.
Hello everyone, my name is Angelina Fatamulia with last 3-digit number 051. So next I will explain about the diagnosis of albinism. The clinical manifestation of albinism involves ophthalmology and dermatology, such as skin and its appendages. In ophthalmologic involvement, albinism is characterized by impaired visual acuity, nystagmus, photophobia, ametropia, eye stiffness, and strabismus. Nystagmus may appear in the first month of life, which is related to the critical period of fovea maturation. Visual impairment might happen as a result of fovea hypoplasia, which is associated with anatomical and structural alteration of the cones. That means the fovea is greater than normal with low cone density, or happen due to abnormal intersection of oculomotor fibers and temporal visual fibers. Photophobia in albinism may occur due to melanin deficiency that cause reduction of light filtration. Ametropia or refractive errors that often occur in albinism, such as astigmatism, hyperopia, and myopia. All types of strabismus are also possible to develop due to misrouted optic nerve fibers at the chiasm. In skin and appendages involvement, the main characteristic of albinism is hypopigmentation. Albinism can be diagnosed by physical and dermatological examination, electrophysiologic studies such as ERG and VEP, imaging include MRI and OCT, and molecular genetic identification. The ophthalmology clinical examination can help to confirm the diagnosis, and it can be done by slit lamp that will show iris starch illumination, and eye fundus examination that will show retina hypopigmentation and loss of foveal reflection. For skin examination, the skin pigmentation also compared to the familial pigmentation due to variability of hypopigmentation in each patient. The result of ERG is usually normal. VEP will show asymmetric cross response during monocular stimulation. OCT helps to confirm clinical obscurity of foveal hypoplasia and show morphology and thickness of the fovea, while MRI is used to eliminate differential diagnosis during the first year of life. Thank you.
Okay, my name is Ananda Karaharja with last 3-digit of student ID numbers 136, and I will continue the treatment. So albinism has no treatment because it is a genetic illness, and the focus of the treatment is on providing appropriate ophthalmology care and then dermatological care and also skin protection. For the eye care, it includes eye assessment in early life and then regular eye examination to ophthalmologists. For the skin care, it is also important to prevent skin cancer, and patients also need to be educated to avoid UV exposure in the long term, and an application of sunscreen, additional protective clothing, and avoiding drugs that can increase photosensitivity. And for the direct therapy modalities are still in the research process, and there is no clinical evidence. Okay, maybe that's all about the treatment. The next slide will be continued by my friend. Thank you.
My name is Putu Ardisa Pradeswari with student ID number 200211172. So I will explain about the complication and the prognosis of albinism. And first, I will explain about the complication. For the complication, albinism can affect the quality of life of the sufferers, both as physically and mentally. If left untreated, people with albinism can experience the following condition. First, difficulty or inability to read, work, or drive due to the eye problems, and burns from the sun exposure that can develop into the skin cancer. Stress due to the sufferer's feelings of inferiority because he sees or she sees herself or himself as different, or as a result of the bullying from the people around her or him.
And for the prognosis itself, for the prognosis of the albinism usually does not really affect the lifespan of the patient, although for the vision function is usually severely impaired, but for the intellect and the development are normal in most of the patient. That's all for me. We'll continue with my friend. Thank you.
Hello everyone, my name is Saman Christian Surya, but last 3 digit student number is 150. So now I'll explain about the chapter 3 of our student project. Conclusion of our student project are albinism is type of melanosis that affect melanocyte level in ectoderm-derived tissue, most notably in the skin, hair, and eyes. The epidemiology of albinism is estimated to be at 1 per 17,000 until 1 per 20,000 individuals. The pathogenesis aspect of albinism involves tyrosine gene mutation, which contributed to the inability to produce eumelanin. There are several forms of albinism, namely OCA, OA, HBS, and CHS. Any form of disease are caused by hereditary mutation associated with its own specific genetic aberrations. Albinism can be diagnosed from ophthalmologic and dermatology clinical examination, physiologic studies such as ER, VIP, and imaging. Currently, there are no treatment because it's a genetic illness, and the focus of treatment is on providing appropriate ophthalmologic and dermatologic care and skin protection. We suggest a comprehensive discussion that should be carried out by reviewing aspects of the pathogenesis, clinical manifestation, prognosis, and complication of each type of albinism. Further literature review and describe aspect of albinism differential diagnosis with the aim of knowing the type of disease with the same sign and symptoms as albinism. We also recommend further research to review the potential utilization of gene therapy as a preventive modality for albinism. That's all from me. Thank you.
Hereby are references that we use to make this paper. We would like to say thank you for all the attention, and we would love to hear any question or feedback regarding our project. Thank you.